Okay, so today we are going to discuss something about the mouth infections, especially the mouth ulcers and the mouth cancers, and these all are actually the infections that are associated with the mouth. So we can say that mouth are also infected by some bacteria as well as some viruses, and we can say that there are many infections that can cause the inflammation and swelling in the mouth, right? So if we talk about the too much a general mouth disease, that is a mouth ulcer. So you see here that this mouth ulcer looks like this, like just like a ulcer on the lip, and as no, this is not a lip, like it's actually the internal part of the mouth. And so what happens, it might be due to any viral infection or due to any fungal infection, and it can be taken place due to the, we can say that it might be taking place due to the dental braces, like some people wants their teeth to be aligned up and wanted that their teeth must beautify. So they take some types of the treatments related to the dental braces, which will, we can say that due to the stiffness on the teeth and due to the because they comes in contact again and again with the instruments. So we can say that might be there is some type of contamination. Contamination means there might be some type of exposure of bacteria to the mouth, and we can say that it may be caused by the toothbrushing and accidental biting of lip, like if accidentally any person bite his lip, or we can say that during toothbrush, if we are not like we are not following the proper procedure and we are just rubbing up, so it can cause, and especially it can also be caused due to the lack of vitamins, and especially the vitamin B12 and iron. So we can say that the deficiency of vitamin B12, folate and iron, these all the things together can cause the mouth ulcer, and as a result of which these are actually all the causes of the mouth ulcer. Now we are going to discuss about the signs and the symptoms. So we can say, yeah, we can say that ulcer occurs on the mucous membrane of the oral cavity is known as a mouth ulcer, and we can also say, call them as a sore, as a cankered sore, because they are too much we can say that too much there is pain in them, and there is also swelling, and there is also an inflammation. So we having difficulty in eating, and difficulty in biting as well, and difficulty in chewing, because when we chew, then the food also comes in contact with these ulcers, and then we can say that it feels pain, right? So we can say yes, actually they are too much smaller in size, their size is all not so big, they are too much smaller in size, and they can be taken place either on the mouth or either on the gums. And as we have already discussed about the causes, but if we move towards the signs and symptoms, then we can say that they are too much painful sores and swollen skin, like inflammation or reddish skin. And we can say that, as I have told you, that we having difficulty in chewing or in biting or in eating. So that's why when a person feels difficulty in biting or feels pain in eating, then he must avoid eating the food. So we can say that's why the loss of appetite also takes place. And in case if we comes if these sores comes in contact with the salty or spicy or the sour foods, then as a result of which ultimately it will leads to the to pain, to a burning sensation. Okay, so if we talk about the treatment, then actually there are too many herbal type treatments are also available, and medicinal treatments are also available. In case of the medicinal treatments, many ointments are available here, and in case of the herbal treatments, like there are too much herbal, we can say that ointments as well as some powdered form, things are also present, so which we can use like different herbs. We can just have a paste of these herbs and we can place it on the mouth and or on the this affected part of the mouth, and then ultimately we get relief. But it will takes about 8 to 10 days to recover completely. It's not the threatened disease, or we can say that it's not the alarming situation, but we can say that the mouth ulcers is a sign that we must have a look on our health and hygiene, and especially the health and hygiene that is related to the mouth, like brushing the teeth. Either we are brushing or not, what is the procedure we are following while brushing the teeth, and these all the things, which toothpaste we are using, and as well as the most important thing is that we must discard our brush after every 3 or 2 months, because we can say that bacteria can adhere to the brush and then they can cause different types of the infections, because directly the brush comes in contact with our teeth. So it's also very much important to take care of our brush. Okay, so this is about the mouth ulcer. I hope you understand this. Now if we talk about the oral cancer, oral, the word oral means that if we talk about the word oral, then it means that we are talking about the mouth, right? Because orally, and like when we say oral presentation, it means that something is going to be happened from the mouth. Oral test, so that is there is something which involves the listening. Okay, so that's why we are saying this here. Now what is oral cancer? In the oral cancer, so we can say that abnormal cell growth on the cheeks, gums, roof of the mouth, tongue or lips, and abnormal growths. Now you can say here the abnormal growths, any we can say that any type of mass is developed on the skin, right? And abnormally they are going to grow without, we can say that without any type of stop. As you know that cancer means that there is something, there is an abnormal cell division of the cells, right? So we can say that abnormal cell growth takes place here. So in short we can say that the risk factors includes the alcohol, the tobacco usage, and about the treatment, we must have a biopsy, and then we must having any type of the surgery, radiation and chemotherapy. I will let you know about it in the detail as well, that what is an oral cancer. So if we talk about the yes, symptoms, so you can say here, you can see here the symptoms of the oral cancer, that what happens actually, the remember the causes of the oral cancer is that the abnormal growth is taking place under the mouth, right? Now if we talk about the symptoms of the oral cancer, then you can see here that it's just like the red or white patches. If you look here, it's just like the white patch, the white patches here on the skin, right? And sometimes there is a lump in the neck region, as well as there is the loosening of the teeth, like due to the oral cancer. We can say that when the health and hygiene of our mouth will not be maintained, as a result of which what happens, that tooth decay takes place, and we can say that mouth ulcer is also going to develop, and pain during swallowing, like if we are eating anything, so definitely we swallow that thing or we engulf that thing, right? So during the engulfment of that thing we feel pain, and then numbness in the face and the neck area, at this area and at the face we feel like something like numb like feelings, and we can say that sore tongue, or there is a swelling on the tongue and it gets reddish in color. So if we talk about the 3 signs of the oral cancer which must not be we can say that ignored, these 3 signs must not be ignored, like a sore that doesn't go away, red or white patches. A sore that doesn't go away, it means that if any person develops mouth ulcer, and what happens that this mouth ulcer is not recovering, there is no recovery of the mouth ulcer after many months, so we can say that it's a sign of the oral cancer, that why it's not healing, right? And there are many red and white patches on the mouth, so we can say that this thing as well. And there is a persistent pain or tenderness when swallowing. Okay, so we can say that tenderness when swallowing, the same thing, that if these three signs occurs or appears in any person, then one person must assure himself and must contact to the doctor to assure that if he has any type of the cancer or not, right? Then if we talk about the treatment, yes, if we talk about the treatment, then the treatment will be like surgery, or might be it will be radiation therapy, or it will be chemotherapy. So there are certain side effects of these types of the treatments, like we have discussed so many times that radiation therapy is something which is taking place in the presence of the radiations, like by the help of the rays, and chemotherapy by the help of the chemicals. So these chemicals must have some side effects, these radiations also having the side effects, and surgery also having some side effects like taste loss, mucositis, it means that there is an inflammation still, and even after the surgery too many complications takes place. So we can say that the treatment is available, but though there are too many complications. So we can say that 40% of the patients receiving chemotherapy for any malignancy will experience oral complications. Like we can say that 40% of the patients who are receiving the chemotherapy treatment, chemotherapy means that who are treating themselves with the chemicals. So what happens for any malignancy means for any type of the cancer that is threatened, so they are suffering from these types of the mouth complications, like which we can say that the oral complications. Now the next one is the tonsillitis, the very famous mouth disorder. It's actually the tonsils, we can call them as a tonsil. So tonsillitis is an inflammation. Tonsillitis, it means that it's some type of an inflammation. So tonsillitis is an inflammation of the tonsils. Tonsils are lumps of the tissues at the back of the throat. You see here that at the back of the throat, if you see, there are two red faces. These faces are actually the tonsils, and they adhere at the throat, at the back of the throat, and we having too many symptoms, and these tonsils might be viral or might be bacterial. So it's really necessary to reduce the size of these tonsils, and as well as also either to reduce the size of these tonsils, or either to get them out of the mouth, because they can, due to them, we can say that we having difficulty in swallowing, and as well as in the eating, so as well as in the breathing, because they are actually they are going to block the pathway of the eating and the breathing, as if you know that these two pathways are linked with each other. If you know this, that these two pathways are actually linked with each other, like uh, there is a food pipe and there is a breathing pipe, which we call as a trachea. So this is a food pipe, and along with it there is a breathing pipe. So we can say that these two pipes are together. So at the above of these pipes, when there are tonsils, so we can say that they are going to block, right? They are going to block our system. So the symptoms includes the sore throat, the bad breath, as well as trouble in swallowing, and we can say that fever, as well as red and swollen tonsils. Tonsils gets like their size increases and they gets reddish in color and swelled up as well. And if we talk about the prevention, then how can we prevent the tonsils? The question is that, so regular and thorough washing of the hands in order to prevent or in order to save ourselves from the bacterial infection. And we also use a tissue to cover the coughs and sneezes, because mouth, like we can say that due to the if any person is suffering from the viral infection and he is experiencing coughing and sneezing, then the droplets can also transfer from a person to person and can cause the disease. So like this, and we must avoid sharing the food, liquids or utensils like dishes and glasses, etc. So if any person is experiencing fever more than 102 Fahrenheit, or if he is also experiencing the muscle weakness and the neck stiffness, the sore throat, and even after the certain home remedies the sore throat won't go, then we must have to see a doctor. And for the treatment, we can say that there are certain antibiotics, and by the help of certain surgeries, and we have to get a lot of rest and then drink the plenty of fluids and gargles with the salt water gargles. And as well as we also have to, we can say that with the warm lukewarm water, it will also add some type of soothing feeling. Okay, so types of the tonsillitis and treatment methods. So we can say, if you remember that at first we have discussed about two types, like one is acute and one is chronic. So acute is this which can last up to the 10 days, we can say that it can be finished very easily, while the chronic tonsillitis is that type of the tonsillitis which we can say that it cannot be treated, and it's chronic means it must be a long term exposure of the tonsils is here. So we can say that treatment will be like tonsillectomy, and tonsillectomy means the surgical procedure for removing the tonsils, right? So we can say that this thing must be happened in order to treat the chronic tonsillitis. Okay, now the last one is that of what is gingivitis. Gingivitis or gingivitis is also one of the important infection, but it is actually related to the gum. If you see here, this is the gum, this is a mouth, and this is a gum. Okay, inside of this lip there is a mouth. The whole section is called as a mouth, but the above the teeth, that this is a gum, right? So what happens that it's actually an inflammation that is taking place in the gums, and it's actually causes the irritation, redness and swelling in the part of the gums, and this part of the gums is known as a gingival. So that's why we are calling it as the gingivitis. So we can say that if it's left untreated, then it can leads to the tooth decay, as well as means we can say that it is taking place due to the viral or bacterial infections as well, right? So we can say that what is the gingivitis? It's actually the most common type of the gum disease, and in which the swelling in the gums takes place. Most people have a long term case of gingivitis caused by the plaque. Bacteria builds up over time and starts to irritate and inflame the gums. Like definitely it's a bacterial infection, so we can say that bacteria is going to develop here, is going to reside here, is going to develop here, and also causes too much irritation and redness. So a person will not feel well at any cost. Like this, like the teeth are surrounded by the swollen gums, so dark red or reddish purple type gums. And we can say that persistent bad breathing, bleeding gums, as well as the bleeding also takes out of the gum. Tender gums or puffy gums, means these are the conditions depending upon the severity of the infection. So if we talk about the treatment of the gingivitis, then it will be, we can say that our periodontist or the dentist must clean the teeth to, first of all, to remove the harmful bacteria, plaque or tartar. Like if there is any plaque, what is a plaque? Plaque is actually any type of yellow colored textured on the just above the teeth, so that is called as a plaque. Okay, and if there is any bacterial infection, like just below the gums, if there is any bacterial infection, then they must clean that type of the bacterial infection. Okay, so additional gingivitis treatment includes scaling and root planning. If you remember the root canal procedure, as I have explained this in the previous lecture of the teeth, and this procedure is similar to a routine dental cleaning but reaches deeper beneath your gums. Like in the root canal, there is actually, they are inserting the root canal inside of the teeth. Okay, so it's not, we are dealing with the gums. So they, what happens that actually they remove the teeth and then they cleaned up the gum beneath the gum. They clean the portion, whole portion, and just like then they will like clean the gum, and so that the bacteria cannot reside over here. And they also make sure that now the bacterial infection must not revived, right? So here we have discussed about the mouth cancer, the mouth ulcers, the tonsillitis and the gingivitis. So hope you enjoyed the lesson. Thank you.